So, hello, this is Dr. Rita Poptani, mentor at Horizon Education. So, we have Niral here who has recently given her NEET exam, which was on 2nd May 2022. So, let's have a brief talk to her. Right, first, Niral, give a brief intro about yourself. You're not audible, just a minute. Yes.
Hi, I'm Dr. Niral. I have been studying with Dr. Rita Poptani since December, and I have just given my exam on 2nd May. She has conducted many lectures of various clinical subjects, and her lectures and her PPT are thorough with knowledge. She has covered almost all the important topics in the PPT, and lectures are daily, so you can concentrate, you can revise and recollect the topics, and you can revise it in proper time. Lectures are separately taken, so it is very nice experience. Her skills are very her knowledge is very thorough and her skills are very nice. She presented every topic with immense knowledge and skills.
Thank
Thank you.
for your appreciation.
Yes, ma'am. Well,
Yes, so Niral, when did you complete your BDS and which year basically, and how many, if at all you have given any NEET exam previously?
ma'am, I have completed my BDS in 2018, and I had given exam previously for 3 times. At that time, I had prepared, but I was not in such a good state, and I hadn't joined. I had joined academy, but knowledge was not that much thorough. So with your academy, my experience is very nice. I can clearly see myself in confidence that I can remember topics. I have given the exam, so I have realizing that yes, madam has taught, that she has already taught us that it is important topic. This question will gonna ask, they will gonna ask you. So it is very nice, ma'am.
Okay, so like we keep on saying like this topic is important for exam, these things can be asked, and how much we had predicted, was that prediction successful in your preparation? Like really there were questions on that topic or more or less near to that topic?
No, ma'am, your prediction was very good. I can say 40 to 50% of paper content was from your prediction.
Okay, so which is very good amount, right? So that
Yes,
is itself a very good thing. So if the student is just preparing our presentations, whatever we are giving, and focusing on the topics that we are saying that this is important for exam, that also will help to boost the rank of that individual. Okay, so there are high chances that you can secure a good seat in the first attempt itself. Right, what difficulties did you face during your exam, or what was good in your NEET exam as compared to your previous exams? Like any difference you can see?
ma'am, first difference is I was able to complete the paper previously I was not able to complete the whole paper. लाइक लास्ट मिनट में मेरा कंप्लीट होता था. इस बारी मैंने हाफ आवर पहले से कंप्लीट कर दिया था. मैंने सारे जो मेरे रिव्यू करने के लिए क्वेश्चंस थे वो सारे मैंने रिविजिट किए, फिर उसको मुझे थिंक करने का भी टाइम मिला. सो जो डेली टेस्ट है, आपकी प्रेजेंटेशन है, लेक्चर्स है, वो सब ने इतनी हेल्प की कि मेरा माइंड अब अभी थोड़ा ट्रेन हो गया है कि यस एमसीक्यू ऐसे पढ़ते हैं. वो जो स्पीड है, कंसिस्टेंसी है, वो पहले नहीं थी मेरे में. उसी की वजह से मेरा पेपर खत्म नहीं होता था. अभी इस बारी डिफरेंट ये है कि पेपर भी जल्दी खत्म हो गया और पीपीटी में से बहुत सारे क्वेश्चन थे. अभी हमने जितने भी सब्जेक्ट किए उतना में से तो मैंने बहुत अच्छा स्कोरिंग किया है.
Right. So I keep on saying that daily tests are required to be given daily, right? Since your mind
Yes,
is not trained, since your mind is not trained, because previously in the up to from first to final year BDS, you are giving a theory exam, right? So this is for the first time you will be encountering an MCQ based exam. So where your mind is not trained to read a question and read the four question options about it and then answer. And moreover, the time limit you are given, that is 3 hours for solving 240 questions, which is not like matching your speed. So your mind has to
Hmm.
be trained in that way that you are speedy enough to read the questions, and at the same time you don't forget to read not in the question or read except in the question, which can change the entire answer for that question, right? So Niral has been very consistent in
Yes.
giving the daily test. He used to give the daily test daily, and I usually used to have a one-to-one basis conversation with my students through WhatsApp, where I ask them to send the screenshot after the daily test. Apart from that, they also keep on giving the major test at the completion of each subject. But since daily test is something which will boost the mind daily, right? Major test, they don't have that much time to sit for 3 hours and give the exam, right? So daily, anybody can't sit for 3 hours. But I used to train that daily, at least you can sit for 20 minutes, right? So our daily test was hardly of 20
Yes,
minutes,
ma'am.
and that has changed the mindset, and that has prepared my students very well, that they can read the questions very well. So you can, from her only you can listen that she was able to complete the exam 30 minutes before, so which itself in itself is a very great thing. Right. And lastly, like Neeril, how long you have been with us, like how many months you were there with us?
Ma'am, since December I had joined, so it has been 5, 6 months only.
December, Jan, Feb, March, April, right? May you
March,
were having
April.
exams. So she was with us for 5 months, not even 6 months. And
Yes, ma'am.
so in that 5 months, I had targeted that. See, lectures also I used to take only 1 hour, because students get saturated for sittings for so long. And ultimately, the mind can tolerate only some sort of things
Only-
and digest only that part. So if at all we keep very long lectures, it makes no point for the students, because anyhow they're not going to grasp it. Right. So lectures were very tailored. Like we used to have only 1 hour or 1.5 hour lecture each day. And I used to have the lecture every day according to the convenience, whatever time sets to all the students. And I had worked out things in the way that whatever was most important was taken at the first, right? And clinical subjects I had completed early for them, and basic subjects I had all done assortment in that. So we used to discuss MCQs also at the end of the subject, right? Because just theory
Yes,
will
ma'am.
not help, just MCQs also will not help. So it was a good amalgamation of the theory as well as the MCQs. And yes, Neeril, from clinical subjects and from basic subjects, after the theory and this part, so basics we have not touched much. I had taken
Yes,
only
ma'am.
few
Only clinical.
few lectures only I had taken for the basics, because in the batch there was one student who has a practice since last 15 years, right? And he is now willing to give an MDS exam. So it's very
Mhm.
difficult for him to grasp anat or pharmac subjects like that. So we had very customized the course accordingly. And yes, Neeraj. So after that basic sciences, from the basic sciences section, whatever we had taken, I think I have taken 4 or 5 lectures for the basic sciences. So what is your output from the NEET exam? Like what benefit you got from those lectures in the final NEET exam?
Ma'am, in basic subjects, you had taken only 4, 5 lectures, but I remember that one question was IM इंजेक्शन साइड जो करंटली आपने बताया था वो क्वेश्चन था एग्जाम में। फिर मेडिसिन में भी बहुत सारे क्वेश्चन जो आपने करवाए थे वो उसी पीपीटी में से आए थे। जो पेपर्स हम डिस्कस करते हैं ना लास्ट ईयर्स के लास्ट में पीपीटी में से, उसमें बहुत सारे क्वेश्चंस थे। सो इट वाज वेरी गुड। यस मैम।
Okay, so we have at the end of every theory class, usually used to discuss the MCQs from the recent papers. Last 5 years, I discussed in that NEET exams and I set exams and the recent SRC papers, if at all, whatever is important, that all I used to cover. And usually our theory class is like, it takes 6 to 8 lectures to finish, right? And that also in my regular batch, I have lectures on Monday, Wednesday, and Friday. Niral was in both. She is in regular batch also. She was in exam going batch also. Our exam going batch lectures were like one lecture every day, and that was 1.5 hour daily. Whereas our regular batch classes are run on Monday, Wednesday, Friday, and the timing is 7 to 9 p.m., where we take 2 hours lecture. And again, so there we like 6 to 8 lectures, we finish the theory part for that particular subject, whichever is taken. At the end of that 8 lectures, we have to do 3 lectures for MCQ solving, where I discuss all the recent papers. And after that, if at all any person is having any individual queries or some doubts are there pertaining to that subject, so in 1 or 2 lectures after that, we finish the queries. So this is the usual sequence. And we have tailored the course like, we are not finishing all the clinical subjects at a stretch, because basic sciences at the end when we take, people get saturated that ANET complete हुआ उसके बाद फार्मेक के बाद complete हुआ माइक्रो, so they get very saturated कि इतना सारा कैसे पढ़ेंगे, right? So we take one clinical subject, then we take one basic science subject. Like I had taken pedo first, then I had taken anatomy, then again we went into a clinical subject, that is OMR. Right, so like that our cycle continues, that is one clinical subject and then one basic subject, so that students are also at a normal pace, not that much stressed that all the basic sciences subjects are बाकी है, अब ज्यादा पढ़ना पड़ेगा, कैसे करेंगे. So वो सब चीजें overcome हो जाती है in this fashion. Right, lastly, Neil, I would like to ask, will you recommend us to other students?
Yes, ma'am, definitely, ma'am. I will surely recommend you because of your you really care that students have given test, they are reading or they are not reading, and the method of teaching is very appropriate and it is very good. Half of my topics I have been not revised. मैंने सिर्फ आपको सुना था और वो टॉपिक्स मुझे याद थे एग्जाम में, सो उससे मैंने क्वेश्चन सॉल्व किए हैं.
राइट, वो फिर लास्ट में ऐसा होता है कि आपने पढ़ा नहीं है पर मैम की आवाज कानों में गूंजती है.
हाँ, यस मैम, यस डेफिनेटली. हाँ, वो जो आप बोलते थे ना कि ये तो आने ही वाला है, ये लोग पूछते ही है, ये याद रखना, वो टॉपिक्स मुझे एग्जाम में भी याद आ रहा था कि ये मैम ने बोला था ये पूछते हैं, ये तो आने ही वाला है. तो वो बहुत काम लगा कि
आई
मेरे
हैव,
पास उतना टाइम नहीं बचता था
राइट,
प्रैक्टिस के बाद, फिर भी मैंने वो जो लेक्चर्स और पीपीटी और जो अटेंड किया है उसमें से ही दिया है. और अच्छा, बहुत अच्छा एक्सपीरियंस है मैम. डेफिनेटली अदर्स शुड जॉइन द एकेडमी. यस,
right. See, Niral is not learning or not they are dedicated to NEET pura full time. She don't have that much time also to read, right? She is working at a private clinical practice, and she what are your timings there, Niral?
मैम इट इज इवनिंग सेशंस 4 to 8 p.m.
And morning also, she is a housewife, so she has responsibilities of that also. So apart from
Yes,
that,
ma'am.
she's doing this, right? So it is commendable what she is doing. And yes, so this is all about us, Horizon Education for NEET MDS. So if you are looking for a coaching academy for NEET MDS, this is something which you should look for. Right. So thank you, Niral. It's a
Definitely,
pleasure
ma'am.
having you here. Okay.
No, ma'am, thank you so much. I have been very blessed to join the academy, and the knowledge you have shared, this I will carry for life in my clinical practice also. So I am very grateful to you.
That is very important, because see, reading is not just applying for the clearing the NEET MDS, it's
Yes,
also
ma'am.
for applying those things in the clinical practice.
Yes, ma'am. Sometimes I have been in clinic and I have seen some cases. So things which you have taught that clicked in mind, that yes, ma'am has taught for this clinical case, I have to apply this.
Right.
So it is the knowledge which I would like to carry for lifetime.
Yes. So thank you for your kind words of appreciation, and thank you, Niral, once again.
No,
Wishing
ma'am,
you,
thank you. I am
wishing you
so
all the
grateful
success.
that I had been so grateful and blessed to join your academy. Thank you so much for teaching us.
Thank you. Thank you. Okay, so goodbye, Niral.
Goodbye, ma'am.
See you again. Okay.
Okay.